innovation, and I'm really excited to be here today to talk to you about mission-driven innovation. Just a few of the notes that we'll cover today. I'm going to give you a little background on PDMA. I'm also going to talk about the United Nations Sustainable Development Goals, provide you some data and some funnels for some fun. We'll use the O2 Cube case study, which I've been involved with for nearly 5 years. We'll use that as a case study. And then finally, I want to wrap up and talk about a PDMA special interest group. So with that, why am I here today personally? Here's my hypothesis. PDMA's community of product innovators and managers, we have this immense opportunity to leverage innovation to improve the lives of billions of people by focusing our skills and energy on the underserved regions of the world. So that's what I believe. That's why I'm here talking to you today. Just to be clear, this is a bit of a personal journey for me. You can see the photo on the left. That is me 32 years ago, launching my first product ever at a big trade show. And so I was, for many years, have been doing product development in the corporate environment. In 1998, my company won the OCI award from PDMA. So my world was a good world of product development in the industrialized nations. I took a position 5 years ago as a professor at the University of Pittsburgh, teaching a course on medical product innovation, and was ready to retire to the golf course and enjoy life. And then these guys came along 5 years ago. One of my students, James Newton, went to Malawi, Africa, and witnessed firsthand the children in particular that were dying from pneumonia. This is an actual photograph James took while he was there. And he came back really inspired to do something, feeling that this was a terrible, terrible thing, that nearly 800,000 children were dying every year from pneumonia. So my life took a bit of a pivot. Let me talk about PDMA for a moment, and then we'll get on to Lean Med. So PDMA in our community, we're a bit unique in that we include people from industry, from academia, and service providers, and we serve nations, organizations, and individuals. And I maybe emphasize nations because in some parts of the world, innovation is very, very critical to the future of some nations, and they've really embraced what PDMA is all about. Again, our tagline, connecting innovators worldwide. We serve every industry. We all know as the PDMA community that our concepts and our best practices are completely universal, and what can work in the consumer packaged good can also work in banking, in industrial, and so on. We're a global community. We have members in 47 countries. We have active chapters in 19 locations. So we really do span the world, and find it a very powerful strength for us to have this global reach. Our offerings include a range of items from certification and professional development. You see our body of knowledge there in the image. We also publish books and a quarterly journal, the Journal of Product Innovation and Management, a peer-reviewed journal. We have online communities such as LinkedIn with over 60,000 members, and we communicate through newsletters as well. We provide digital content via webcasts, virtual workshops, and our online digital library, the Knowledge Hub, or K-Hub as we call it. We put on events all the time, as we're here today at our annual conference here in Orlando. We also do regional and local events as well. And finally, we provide recognition both at the corporate level through our PDMA Outstanding Corporator Award, as well as individuals for outstanding commitment to the profession of innovation, such as the Crawford Fellow Award and the Alan Anderson Ambassador Award. I want to switch gears now and talk for a moment about the United Nations Sustainable Development Goals. These are a broad range, as you can see, 17 goals that the United Nations has laid out to make the planet a better place. It's a broad look. I'm going to focus on 5 where I think we as innovators can have the greatest impact. So I'm going to give you some numbers to think about. 689 people live in extreme poverty. That's defined as living on $1.90 a day. 773 million adults are illiterate. Over 1 billion people have no access to electricity. 2.2 billion people don't have safe drinking water. And finally, about 780 million people go to bed hungry every day. Just so we're not just looking at numbers, I just thought I'd put some images up. Poverty, illiteracy, no electricity, lack of clean water, and hunger. So it's a bit of the world that we live in today. Now, how much money is spent in these areas? And this is just to illustrate, it's not a one-to-one, but I wanted to put some numbers in front of everyone today. So how much money is spent in these areas? Well, on startups in the US, these are all US numbers, we spent $328 billion just last year on startups and, creating new companies and raising the standard of living for people in the United States, $328 billion. 67 billion was spent in higher education on R&D in these areas. Over $8 billion spent on grid power in the United States in 1 year. 50 billion on clean water spent a year ago in the United States. And then finally, just in the private industry of food and beverage, over $20 billion spent on R&D. So all of you in this audience, I'm sure, are familiar with what we call the innovation funnel. It can be vertical, it can be horizontal. But the notion is that a lot of great ideas come in at the top. In the PDMA literature, we talk about 100 great ideas producing maybe 100 ideas producing maybe 5 great products. So that's the innovation funnel. I have a new funnel for you to think about today. I call it the neglect funnel. And what I mean by that is here's this wealth of energy and money spent in the high income nations to improve, education, to improve healthcare, to improve our diets. But when you operate in the world that I do today as CEO of LeanMed, you realize in these low income countries, it's just a drip, drip, drip that gets through. So I think that's the gap. That's the gap where innovation can help bridge. So it's my belief that R&D focused on higher income consumers must be translated through innovation into viable, valuable products and services for low to middle income countries. So now I'll shift again and go over to LeanMed, the company that I helped found, and talk about it in the context of lean startup, but also how innovation can make a difference in people's lives. I'm going to talk about lean startup, some key elements, and then again illustrate how we applied them in the case of LeanMed and our first product, the O2Q. 3 stages of a startup. It's important in the beginning. You better have a problem worth solving. Many times I've been involved in projects and had people come to me or to my class with what they considered outstanding new product ideas. And at the end of the day, people really didn't care. There really wasn't a problem there worth solving. If you have the problem worth solving, come up with that solution that you think can work. Go through the work that goes into product market fit and validating that there's customer demand, and then and only then start scaling up once you've demonstrated product market fit. And one thing I want to add, what I've learned over these last few years is that in the NGO, nonprofit world, the charitable world, the UNICEFs, the WHOs of the world, there's all this focus on social impact, and rightfully so. You want to make an impact on the planet. You want to make a difference. Well, in the entrepreneurial world, you really haven't done much until you've scaled. If you don't ever get to scale, you've really maybe had a clever idea, but not taken it a lot further. So for me, as an entrepreneur, also interested in making a difference in the world, scale equals social impact. They're not in conflict with each other, they complement each other. Okay, so we'll talk about lean med and the problem that we're dealing with. As I mentioned, James went to Malawi, saw how many children were dying from pneumonia. You can see the numbers there, 800,000 per year. 99% of those deaths occurring in the developing nations, in the low-income nations. We were started on this 4 or 5 years ago. COVID came along, and if anything, it shined the light on the lack of oxygen access, and that why so many people were dying from treatable diseases like pneumonia. So that's our problem we're trying to deal with here, access to medical oxygen. The solution is a solar-powered medical oxygen production system called the O2 Cube. Just to explain a little bit more how it would work in this context, a child becomes symptomatic at their home in a village somewhere. They come to a health clinic that lacks grid electricity. They hope to be diagnosed properly there. Even then, with the diagnosis, they have to be referred to a hospital where there's a ward and hopefully medical oxygen available. What the O2 Cube does as a solar-powered oxygen production system makes medical oxygen available to the patient earlier in the treatment cycle, and thereby saving hundreds of thousands of lives. And there's a little shot of the O2 Cube, one of the prototype versions. I'll show you that a little bit more in a minute. Moving on, so problem, pediatric pneumonia killing hundreds of thousands. The solution, solar-powered medical oxygen, bringing a treatment closer to the patient and thereby saving lives. When I look at the history of the company over the last 5 years, really what we've been working to is product market fit. So in 2018, we entered our first competition, took first prize, and with that established the company, and with the help of students at Duquesne University, built our first functional prototype. In 2019, we went to Malawi and did a study on pulse oximetry to understand better the need for oxygen and the amount of children that were hypoxemic. In 2020, we became a finalist in a Duquesne competition, as well as we entered into an incubator. Again, all these steps were testing the idea, the concept of the O2 Cube and the notion that solar-powered oxygen is a viable solution. 2021 was really a breakout year for us. We licensed the technology that we used in the O2 Cube from Philips. We were included in the WHO compendium of innovative health technologies for low resource settings, which was quite an honor. There were 380 submissions, only 30 which made it. And then finally, we won a $50,000 grant from the University of Pittsburgh, all again going forward to build out our prototype and move our work forward. In 2022, another good year, we raised $85,000 as part of a crowdfunding campaign, and we put our first pilot program in place in Nigeria at a 26-bed pediatric ward and began the design of our first commercial units, which will ship in 2023. So again, this body of work, all validating, doing customer validation and confirming that there is a need and a viable need for this solution, the O2 Cube. And then here's just some images to show you kind of how it's evolved from an early design done artist sketch in 2019 to the prototype that we built at the University of Pittsburgh, and now this is a CAD model of what we will ship in 2023. Forward scale up, just a rather busy slide, but just wanted to show you that we do have this 5-year plan to scale the build and sell of the O2 Cubes throughout the world, starting with sourcing and assembly and build in Africa, in late 2024, and then expanding manufacturing through South Asia and into Latin America. So any questions on 3 stages? I think hopefully I've covered them. I want to talk briefly about the business model canvas. It's an essential tool used by entrepreneurs and people deploying lean startup. We don't have time today to go into every box and talk about every node here, but I do want you to know we value it, we use it, and I'll show you a little bit about how we employed it. Here are the Post-it notes done as you do when you do a business model canvas, talking about everything from the customer segments that we're focused on to what our key partnerships are going to be, what our cost structure looks like, and everything in between. So build out your business model canvas, and in one snapshot, get a good feel for what that entire business is going to look like. Then you want to move on and say, okay, here's what we're describing the business as. What are the key hypotheses behind all this? You know, are we going to have the oxygen as a service providers? Are they going to be technically sound? Is our engineering firm Daedalus going to stay on time and on budget? Are our bill of material costs too high? So these are all important assumptions that we're making that are critical to success. You go through them, and then you really look at them and say, you know, what's the impact if one of these fail, and what's the probability of them failing or being wrong? And in that case, you can start to prioritize, and that will build out your test plan. So you prioritize your hypotheses, break them down into the critical assumptions, use a FMEA, failure mode and effect analysis approach, which talks about probability and impact. You want to go after those that have a high probability of occurring and would have a high impact on your program, and do a ranking. From that, you want to build out an experiment. So here's one that we used about that medical staff will use our oxygen cylinders effectively. To verify it, we're going to execute this, what we called our Nigerian fast track program. We're going to measure the satisfaction score of the staff, as well as the amount that the system is used and operated. We want a high satisfaction rating, and we want a utilization rate above 80%. And if we're right, we meet these targets. Here's the answer. It worked very well. This is a little older now, but within a few months, we filled 137 cylinders, treated 115 patients, produced 58,000 liters of medical grade oxygen. So we were very pleased with the result, and this helped us feel a lot better about our work going forward with the O2 Cube. And then last note is on the minimum viable product, right? An MVP, a version of a product with just enough features to be usable by early customers who can provide feedback for future product development. Because we're in the medical device field, there's a lot of pushback that, you know, maybe MVPs can work in the software industry where you can build a landing page or put a false front or a test front and test people's feedback. But when you're dealing with healthcare, you really can't do it. I think we proved people wrong with that. So we developed what we called our fast track system. And this was during the height of COVID, when we really wanted to get oxygen out into the field. So it is a pilot program developed for us to learn from it. What we did is we took already FDA approved components that were usable and regulatory. They were okay to be used in Nigeria. And with that, we constructed a product, not the final product, as you saw by earlier pictures, but something that would produce medical oxygen that was solar powered. And that was what we called our fast track system. We installed it in a 26-bed pediatric ward in Nigeria. That's Moses, the technician who installed it. 93% oxygen purity. This was a tremendous photo that we got back. This is a child being treated in the pediatric ward using one of our cylinders. That white cylinder there was filled on our O2 Cube. So it was a tremendous, rewarding experience. This clinic had never had oxygen until we brought the O2 cube in. So that was our MVP test in Oda, Nigeria. Just a final point on what scale means. Here's what we did with one little pilot in Nigeria over a few months. If 800,000 children are dying every year due to pneumonia, a number of studies have demonstrated if you can make oxygen available, you can reduce the mortality rate by about a third. So if we could snap our fingers and put O2 cubes throughout the world, we could cut the mortality rate in a third. It translates into over 250,000 lives every year. So that's the mission we're on. When I talk about mission-driven innovation, that's what this is all about, a mission to save a lot of young children's lives. In addition, an enormous reduction in medical complications and hospital stays. So in summary, I'm talking to the PDMA community today. I think we have an enormous opportunity to make the world a better place to live, work, and play. Let's use innovation to do that. The innovation is required. It's not just simply taking something that was designed and built for a higher income nation and just dropping it in place. That model's been proven to be a disaster, complete disaster. You have to repurpose, you have to innovate around these new products. What we're demonstrating is what I call mission-driven innovation. So I'm asking our community and the audience today, join me in establishing a PDMA special interest group devoted to advancing mission-driven innovation. My belief is there's hundreds and thousands of you out there that understand how to employ product innovation well, and let's do that to make the world a better place to live for everyone. So with that, thank you, and have a great day.